I'll invite Jodie up now to talk about WINS for us. While we're getting Jodie up on stage with her presentation, there was just a question, Emma, about an email address for you. So if you get a chance, could you pop that in the chat for the participants, please? Thanks so much, Jodie.
Thanks, Mel. Hello, everybody. I'm Jodie Atkinson. I am the Graduate Midwife Program Coordinator for Women and Newborn Health Service, and today I'm speaking about the Graduate Midwife Program, Graduate Nurse Program, and the Graduate Enrolled Nurse Program. I'd like to begin by acknowledging the Whadjuk people of the Noongar Nation as the traditional custodians of the land in which we work, and pay my respects to their elders, both past, present and emerging. North Metropolitan Health Service recognises, respects and values Aboriginal cultures as we walk a new path together. So working at WINS, King Edward Memorial Hospital, together with Osborne Park Maternity and other women's-based health services, forms the Women and Newborn Health Service, WINS, which is part of the larger North Metropolitan Area Health Service. We offer midwives and nurses a high-quality, innovative and patient-centred working and learning environment. This enables us to deliver evidence-based contemporary midwifery and nursing practice that provides women, patients and their families with safe, respectful and compassionate care. WINS' vision is excellence in healthcare for women, infants and their families. Our mission is to improve, promote and protect the health and wellbeing of women, infants and their families. And our values are care, respect, innovation, teamwork and integrity. The benefits of working at WINS, well, we have generous salary packaging arrangement like all public health services do. We have professional development opportunities. We have flexible working and leave arrangements, supportive working environment and culture, rewarding and challenging work roles. There's a very strong teamwork focus. You'll gain an experience in a broad range of clinical and non-clinical settings, and there's opportunities for career advancement. Sorry, my clicker is not working. There we go. Let's see if I can, staff service. So we offer the fitness passport as part of North Metro Health Service, which is a fraction of the price of the regular gym membership. We have on-site end-of-trip facilities. So if you want to ride your bike, the showers, lockers, changing room and a secure storage area for your bike. King Edward also has its own 24-hour gym on site that employees can use for, I think it's $5 a week, and it has a wide range of machines and some group work as well as change rooms and amenities. We have the North Metro Pride Network, which welcomes all LGBTQIA plus employees and allies to connect with like-minded from across North Metro. We also have a well-established wellness committee, which runs many activities throughout the year, including a very popular quiz night. We share the North Metro Wellbeing Support Team and have a peer support program as well. We have EAP and we have staff recognition awards, our Going the Extra Mile awards. Socially, King Edward provides a yearly hospital ball and end-of-year festivities for all staff. The models of care at WINS include midwifery care across the continuum of pregnancy. We have special obstetric clinic midwifery group practices. That should be by 6 now because we now have an Aboriginal midwifery group practice. We have community midwifery program which offers home birth, and our secondary site Osborne Park offers non-tertiary care. So we are WA's only tertiary maternity and gynecological hospital. We are the referral centre for high-risk pregnancies and have state-of-the-art special care nursery for premature and sick infants on site, which is managed by CARS. King Edward also cares for women with gynecological conditions which range from neurological and cancer-related problems to sexually transmitted diseases and reproductive disorders. There were more than 6,500 babies born in 2022. Osborne Park offers a low to moderate risk maternity and gynae unit at Osborne Park Hospital, which provides gynae care, obstetric midwifery care to women with low to moderate risk pregnancies. The models of care include 3 MGPs, which are based in our family birth centre, and 3 which birth in hospital, which is 4 and 5 in the Aboriginal MGP. Their caseload care across the continuum with 4 women per month per midwife. The low-risk model, pregnancy care and family birth centre, home or main hospital. You can have intrapartum care in family birth centre, labour and birth suite, and they transfer home 4 to 6 hours postpartum. CMP is also caseload care, low risk, 24-hour on-call roster, and it has community-based clinics in Joondalup, Coburn, Kalamunda and Rockingham. Other midwifery care, our RMR or rotational midwife rotates through all the areas that you see on screen across the continuum of care, including Osborne Park and specialist clinics like diabetes, maternal fetal medicine and our drug and alcohol service. You can see the huge list of special clinics that we offer in maternity, so diabetes, drug and alcohol, adolescent, preterm birth clinic. We have a mental childbearing and mental illness clinic, early pregnancy, and our perinatal loss service. Services at Osborne Park, the 6 birthing suites, they now include water birth, and they have all the allied health services that the tertiary hospital has, as well as the lactation services, parenting programs, and a level 2 nursery with 6 cots. Most importantly, they have free staff parking, excellent education and prof development opportunities, and the ability to work in a local suburban setting. We have specialist gynecological services, oncology, urogynae. This includes inpatient services, adult special care unit and emergency centre, day surgery unit, stomal therapy services, colposcopy, and you can read the rest on the list, including sexual health. And we also have a procedural gynae clinic. We have our psychological medicine, which comes under the North Metro Health Service mental health graduate program. And we have an 8-bed mother-baby unit. Women can be admitted to the unit from 3rd trimester through to 12 months postpartum, and we do have 1 midwifery graduate working in the mother-baby unit at all times. So a bit more about our actual graduate programs. So this is, I think this was our 2022 group, maybe it was 2021. So we offer a 12-month fixed term contract with opportunities for continuing employment at completion, and there's no requirement for a further recruitment process at that time. We offer a graduate midwife program, a perioperative program and an enrolled nurse program. And starting in March, we will be offering collaborative programs with WACS. Up on the screen, I have the graduate midwife program, which will be 6 months at WINS and then 6 months at a WACS site. And we have just confirmed we will also be offering that in peri-op as well, commencing next year. The graduate midwife program. So recruitment will occur, as everyone has already said, March 2024 for intakes in August 2024, January and March 2025. Graduates are employed to work 8 shifts per fortnight. There is some flexibility there. Our minimum FTE is 0.6, and that can be discussed at interview. And all applicants go through Grad Connect for our grad program. And as you can see from that photo, the WINS Graduate Midwife Program won the Maternity Service of the Year at this year's Australian College of Midwives Awards in September. So what do you do on the program? All graduates receive a very thorough orientation when they begin. This includes 3 full days of orientation to North Metro, WINS and the graduate program. Orientation and dedicated supernumerary time is provided in all core clinical rotations and areas. So that's antenatal clinics, postnatal antenatal wards, breastfeeding centre and labour and bursary and MAFAL. So all graduates attend those placements. We also offer elective rotations. Each graduate attends one elective rotation. Now, they may include services like our visiting midwifery service, emergency centre, mother-baby unit, the neonatal special care nursery, Osborne Park Hospital, or for any students completing the dual degree in nursing and midwifery, we do offer a women's health placement, which is 3 months on our Ward 6, which is any woman under 20 weeks pregnant, oncology and gynae inpatients, and then the remainder of the 12 months is spent in the maternity areas and adult special care unit. We have additional rotation opportunities via expression of interest. These include our research internship with the Research Fellow and Professor of Midwifery, and this is a very successful and competitive program. Our midwifery group practices in the second half of the program, so for 6 months, each group practice has a graduate attached to it. And again, it is competitive and you do need to submit an expression of interest after you have been successful in obtaining a position. And our WA Country Health Service placement. So we offer 3 months in various regions in WACS, and these change on WACS's ability to offer different placements and their preferences of the graduates. These placements do include their flights, accommodation. So professional development, in addition to the orientation at the beginning, graduates also attend fetal surveillance, the RANSCOG FSEP course, obstetric emergencies, which is a full simulation training day, breastfeeding study day, midwifery professional challenges, midwifery career pathways and graduation. And there is now an additional one, there's now 6, there's an additional one in clinical skills in the first fortnight of the core of the program. We also offer 14 clinical workshops throughout the year. We have a lot of support. It's something that we pride ourselves on. So I coordinate the program and I have a midwife educator who works alongside me, Carol Spence. I do all the admin, planning, recruitment, etc. Carol does all the recruitment with me. She's responsible for all of the clinical workshops and the obstetric emergency study day. We have a team of clinical facilitators and a dedicated 1.5 FTE of clinical facilitator support all year round for the graduates, and they work both AM and later shifts up to 7:30 at night. We do professional reviews with all graduates at 3 and 11 months, and we offer a mentorship program. Staff development midwives are in all clinical areas, and there's also a peer support network. If you'd like any further information at all about the midwife program, please don't hesitate to contact me or come to the breakout room after this session. The graduate nurse program in peri-op. So this is also a 12-month program with 2 intakes, August and January. The aim is to gain an introductory knowledge in peri-op and develop the skills to work in this area, and also to gain specialist knowledge and experience in women's health. Peri-op nurses develop critical thinking skills. So again, these are the different rotations, and we have added an additional one to what is on the screen, and that is on Ward 6, our gynecological oncology ward. There will be a placement on there as well. And through our graduate program, we do have the availability of a 12-week rotation to WACS as well, with the same conditions as the midwifery one. Perioperative monthly seminars include the 7 on the screen, and we have perioperative study days, perioperative issues and anaesthetic simulation. All of the graduates attend, plus there's a choice of 2 from the list on the screen that you get to choose which 2 of those you would like to do. Graduates will be provided with an extensive supernumerary orientation program with clinical support. There's a structured workbook with specific clinical skills and objectives to achieve across a 12-month period, ongoing education and resources through an online learning platform, 5 paid study days across the 12-month period, and monthly seminars and workshops on topics relevant to peri-op and women's health. Sorry, my clicker is not working. If you'd like further information, Nicola Ireland is in the forum today and will also be in the breakout room after this session, and will be available to answer questions at the end. Our graduate enrolled nurse program is a 12-month program. It only has 1 intake a year, and that will be in August 2024. There's the rotations included in the EN program is gynae outpatient clinic, day surgery unit, and ward 6, which, as I've said, specialises in all those areas. They have monthly seminars, and some of the topics that include on the screen, which are sepsis, wound management, contraception, diabetes, continence and pelvic pain. And they also have 4 study days. 2 are the cancer across the lifespan and the gynae in time, which is an emergency simulation day, and then a choice of 2 other days that the graduate gets to choose for themselves from WIN's extensive CPD calendar. And for further information about the EN program, you can contact Nicola Goodger at this address, or the phone number on the screen. Any questions?
Thanks so much, Jodie. If anyone has any questions, can you please pop them in the chat? We've got a few minutes before we go to the next breakout room. If you've got questions for Jodie or any of the presenters from North Metro, pop them in the chat, and we can address them now.
And Mel, can we invite Nicola to join us for the chat?
Yeah, of course. Marty, are we able to bring Nicola Ireland onto the stage, please? Welcome, Nicola.
Hi.
No questions.
You must have been very comprehensive in your information sharing there, Jodie.
I feel like I raced through it.
Did you have anything else you wanted to add, Nicola?
We just had a question come through. Can I clarify that the RN positions were for graduate midwives? So no, they're not. They're different programs. So you've got the graduate midwifery program, and then you've got the graduate nurse program, perioperative, which is for RNs. They're 2 different programs. You don't need to be a graduate midwife to go on the perioperative program. We are trying to recruit registered nurses onto the perioperative program.
This one's anonymous, and it says, what does the year look like for a grad in terms of education, discussion days, buddy shifts, upskill opportunities, and possibilities for permanent employment? Every graduate receives 4 supernumerary days in every clinical area. So it's in midwifery, and Nicola can talk about peri-op. So there's no area that you do not have this supernumerary time in. During that time, you get orientation with the staff development nurse or midwife, and then you get buddy shifts with a nurse or midwife, depending on what area you're in. Upskill opportunities, I'm not sure what you mean by that, but in our clinical workshops, we offer venipuncture, IV cannulation, different skills in that sort of area. So hopefully you can achieve those by the end of the program. And the possibilities for permanent employment, as I said in the presentation, there's no requirement for further recruitment. If we have jobs available when you finish a program, they are all offered to graduate midwives. And at the present moment, I think we've got like a 99% re-employment. The last program was just finished. Only one did not stay with us, and that's because they're returning to Victoria. So yes, the opportunities are very good for permanent employment.
So we've got another question. Hello, just wondering if the graduate IRN is only perioperative and not ward-based. So it's predominantly a perioperative program where you do get exposure to all of our perioperative specialties, and you do get that experience in Scrub Scout and circulating. However, we do have additional rotations in PACU, which is our post-anaesthetic care unit, also known as recovery, where you get a fantastic experience to develop those critical care nursing skills. And in that rotation, you also get the opportunity to do an anaesthetic experience stay with a consultant anaesthetist to really understand surgical airway management. Another rotation you will do on the program is the day surgery unit, as well as our post-operative ward 6 gynae ward. So although it's not a ward-based graduate program, there's definitely rotations on the ward, on the day surgery unit and in PACU. So it gives you a really great variety of rotations and a really good taste of what the service has to offer. We've also had another question, do you receive a graduate certificate? Although at this time you don't receive a graduate certificate for perioperative nursing, however, you will have the opportunity after your grad program to apply for the postgraduate diploma in perioperative nursing through Notre Dame, of which we do have some subsidised places available for you to apply through an EOI process.
Is it likely that King Eddie's will employ you if you didn't do a grad program at the hospital? You do a grad at PCH and then you want to work at King Eddie's full-time afterwards. Madeline, look, you would, if you did a grad program somewhere else, you would apply to King Eddie's through the pool, whichever one was open at that time, and you have as much opportunity for employment with us as anybody else. Do you offer part-time graduate programs? The lowest that we go down to in midwifery is 0.6, so 3 days a week. What about for peri-op, Nicola?
For peri-op, we are quite strict in that you need to be on a 72-hour contract. It's quite a condensed program, and there is a lot of learning to do. You are new to theatre, so we do find that anything less than that, graduates do struggle. However, we will take it on a case-by-case basis, but we would prefer to start at the 72-hour mark.
Sarah, the collaborative program with Country Health Service. So what that is there will be the first 6 months for both midwifery and peri-op will be at Edward Memorial Hospital in whichever area it is, whichever grad program you're in. And then the second 6 months will be at a WACS site, and that will be determined with WACS, the graduates' preferences, etc. They will be two completely separate contracts. It is a collaboration in the fact that 6 months will be WINS and 6 months will be WACS.
I'm just going to interrupt there. Thank you, Jodie and Nicola. We've come to the end of our time for this session, but there's been some great questions in there. So just reminding people that all of the health services will be available in the breakout session now up until 10 to 5. So if you have any further questions for North Metro or any of the other health services, please feel free to join them on their floor. I believe WINS are on floor 6 and Charlie's Osborne Park are on floor 5. The mental health programs that presented earlier are on floor 10, and then South Metro, Fiona Stanley Fremantle can be found on floor 7 and Rockingham on floor 8. The list of where people are on each floor are available on the on the page, when you click on services, you can see where everyone's located, and you navigate there using the up and down arrow in the centre of your screen where it says floor. So thank you again to South Metro, North Metro and the mental health graduate programs for your presentations this afternoon. And I encourage everyone to connect in the different floors now. Thank you.